Yes, good morning to all. So in last class, I have discussed about the neuromuscular blocking agents. So in today's class, I am going to explain about the myasthenia gravis. So first of all, what is myasthenia gravis? What is the definition of myasthenia gravis? So myasthenia gravis is an autoimmune disorder. Okay, it is an autoimmune disorder affecting the mainly myoneuronal junction. It is also known as neuromuscular junction. And this myasthenia gravis is characterized by varying degrees of weakness of the voluntary muscles. Okay, so it is a autoimmune disorders affecting the mainly myoneuronal junction. It is also known as a neuromuscular junction, and it is characterized by varying degrees of what weakness of the voluntary muscles. Okay, so myasthenia gravis is a very complex autoimmune disorders. So here our immune system is abnormally it is produces the antibodies. Okay, it is mistakenly produces the antibodies, and that antibodies will destroy the neuromuscular connections. Okay, and this causes the problems with the nerves. Okay, so this antibodies causes the problems with nerves, so that nerves it may communicate with the muscles. Okay, and affect the mainly voluntary muscles of the body. What kind of the muscles? Voluntary muscles of our body, especially the muscles which are present at the eyes, mouth, throat, and limbs region. Okay, so affect the mainly voluntary muscles of our body, especially um, what eyes, mouth, throat, and limbs. The muscles which are present at the eyes, mouth, throat, and limbs. Okay, next one. Um, the cause of myasthenia gravis is what? There is a breakdown of the normal communication between the nerves and muscles. So there is a lack of communication between the what? Nerves and muscles. Nothing but there is a blockade of the neuromuscular transmission. Okay, this myasthenia gravis is mainly occurs due to lack of neuromuscular transmission. So nothing but there is a lack of communication between the what? Nerves and nerve cells and muscle cells. Okay, and there is a no cure for myasthenia gravis. Okay, but the treatment can help the relieve the signs and symptoms of the myasthenia gravis. Okay, so what is the signs and symptoms of mg? That is the weakness it is present at the arms and legs region. Okay, the weakness is present at the muscles, those muscles which are present at the upper limbs and lower limbs, and double vision, and drooping eyelids, especially upper eyelid, and difficulty with speech, and difficulty with chewing, and difficulty in swallowing, and difficulty in breathing. So these are the signs and symptoms of what? MG. Okay, and here the treatment of myasthenia gravis is used to help the only the signs and symptoms. Okay, particularly there is no cure for MG. Okay, there is no particular treatment for myasthenia gravis. So the treatment it is only relieve the symptoms of the MG. Okay, see this one is nerve cell, this one is muscle cells. Okay, this one is neuromuscular connection. Okay, so this one nerve cell and this one is what? Muscle cells. Okay, so this area is no this one is neuromuscular connections. Okay, so it is a normal neuromuscular connection. So see this one is destruction of neuromuscular connection. So this area is the myasthenia gravis neuromuscular connections. There is a destruction of the what? Neuromuscular connections because of that antibodies. So our immune system is activated, and our immune system is mistakenly produces the that antibodies. That antibodies will damage the what? Neuromuscular connections. There is a destruction of the neuromuscular connection. So as a result of neuromuscular connection, there is no communication in between the nerve cells and muscle cells. So nothing but there is a blockade of the neuromuscular connection. So there is a blockade of neuromuscular transmission. Okay, so there is no transmission of the signal from the nerve cells to muscle cells. So that's why there is no contraction at the what? Muscle cells. Okay, and how do these antibodies act? Okay, so our immune system is produces the antibodies, so that antibodies will block the binding of acetylcholine with acetylcholine receptors. Okay, so that antibodies is mainly block the binding of acetylcholine with acetylcholine receptors. Then what will happen? There is no binding of acetylcholine with acetylcholine receptors, means there is no effect of acetylcholine on skeletal muscles, so there is no muscle contraction. Okay, and the second thing is, this antibodies is increases the degradation of acetylcholine receptors. So this what these antibodies are, increases the degradation of acetylcholine receptors. So the number of acetylcholine receptors is decreases, means there is no binding of acetylcholine with acetylcholine receptors. Then what will happen? There is no effect of acetylcholine on skeletal muscles. Okay, so there is no muscle contraction. Okay, and third thing is, it decreases the postsynaptic membrane folds. So these antibodies are decreases the postsynaptic membrane folds, and it is increases the synaptic cleft space. Okay, the space in between that two neuronal junctions is increased by these antibodies. Okay, and see this one is the normal muscle contraction. Okay, this neuron is releases the what neurotransmitter that is known as acetylcholine, and this acetylcholine binds with acetylcholine receptors. This receptor is present on the muscle cells. Okay, and this acetylcholine is binds with acetylcholine receptors, and especially NM type of receptors. Then the signal it will be transmitted to muscle. Okay, then the muscle contraction it will be happens. Nothing but there is a transmission of the signal from the neuron to muscle cells. Okay, this is a normal muscular neurotransmission. Okay, and see this one is myasthenia gravis condition. So here. Antibodies, see this y-shaped thing is called as what, this green color thing is receptor, this antibodies. Okay, so here our immune system is produces the antibodies. It is autoimmune disorder, so our immune system is produces the antibodies. These antibodies will block these receptors. Okay, so this blue color thing is known as receptors, acetylcholine receptors. So here our antibodies. Okay, so these antibodies will block the what receptors, acetylcholine receptors, and this antibodies is increases the synaptic cleft space also. Okay, and it is increases the postsynaptic membrane, decreases the postsynaptic membrane folds, and it is increases the gap of increases space within the synaptic cleft also. And these antibodies will damage the receptors. So this antibodies damages the receptors, means there is no binding of acetylcholine with acetylcholine receptors. Okay, then what will happen? There is no transmission of the signal from the neuron to muscle cells. Okay, see this one is reduced transmission. So why it is reduced transmission? Because of our antibodies is destroys the acetylcholine receptors. That's why there is no transmission. There is no signal transmission from the neuron cell to muscle cells. Okay, see this one is this impaired muscle contraction, and this one is the normal muscle contraction. Okay, and see this um, when now when action potential is arrived at the nerve terminal. Okay, when action potential is arrived at the nerve terminal, what will happen? There is the activation of the calcium channel. Okay, there is activation of calcium channel, the channel which is present at the presynaptic neuron. Okay, then after activation of the calcium channel, there is an influx of calcium ions. Okay, as a result of influx of calcium ions, the positive charged ions within the neuronal cytoplasm is increases. Okay, so as a result of increases the calcium ions in the neuronal cytoplasm, there is an activation of what synaptic cleft. Okay, there is an activation of what synaptic there is an activation of synaptic vesicle, not synaptic cleft. There is an activation of synaptic vesicle. Okay, and what is the storage site of acetylcholine? That is synaptic vesicle. Okay, and as a result of activation of synaptic vesicle, so there is a release of acetylcholine into the synaptic cleft region. Okay, so there is a release of acetylcholine into synaptic cleft region. Then afterwards, that acetylcholine it is moves across the synaptic cleft, and it is binds with acetylcholine receptors. Those receptors which are present at the muscle cells. Okay, there is a transmission of signal from the nerve cell to muscle cells, but it is a normal muscular neuromuscular transmission. But when the person is suffering with or when the person is exposed with any unknown initiating event, so that unknown initiating event like what, any autoimmune problems. Okay, so the immune system is activated, and that immune system is produces the antibodies, and that antibodies is active against the receptors. Or when the person is affecting with what, any thymus gland abnormalities, and when the person is suffering with any genetical mutations or any other genetical problems, so in that cases there is a production of antibodies. Okay, so that antibodies will reduce as the neurotransmission in a three ways. There is a three different mechanisms is there. Okay, so when the person is exposed to any other initiating events, unknown initiating events like any immunity problem or any thymus abnormalities or any other genetical mutations is there, means in that person there is a production of antibodies, and that antibodies will reduce as the neurotransmission. So what is that three mechanism? First mechanism is, it is inhibit the binding of this antibodies are inhibit the binding of acetylcholine with acetylcholine receptors. Okay, and so there is no binding means there is no acetylcholine action on the muscles. Okay, and second one is, it promote the endocytosis of acetylcholine. What is endocytosis? What is meant by endocytosis? Endocytosis means there is a movement of substances from um, outside to inside, that is known as endocytosis. So there is a promote the endocytosis of what, acetylcholine. So as a result of endocytosis of acetylcholine, there is a degradation of what, acetylcholine receptors. Okay, and the third mechanism is, it is destroys the postsynaptic surface. Okay, the postsynaptic surface, it is destroyed by antibodies. So that's why there is a decrease in the number of what, acetylcholine receptors. So the number of receptors is decreases means there is a acetylcholine is unable to bind with acetylcholine receptors. So then what will happen? There is no acetylcholine action on the skeletal muscles. Then ultimately it may lead to muscle weaknesses occurs. Okay, so as a result of these three different mechanisms, so there is a neuromuscular transmission is reduced to skeletal muscles. Then the muscle weakness is occurs, and fatigue is also occurs. Fatigue is nothing but tiredness. So the fatigue with repetitive use of muscles. So that is myasthenia fatigue. It is occurs due to the continuous muscle contraction. Okay. So what is the symptoms of, what is the clinical presentation of this myasthenia gravis? That is diplopia. Diplopia means double vision. Ptosis means drooping eyelids, and snarling expression. Snarling expression is nothing but it is a one kind of facial expression. So it is indicates a person hate or anger. Okay, and dysphagia. Dysphagia means difficulty in swallowing. Okay, and nasal speech, and proximal limb weakness, and respiratory muscle weakness. So these are the clinical presentation of the MG. Okay, so when the person is exposed to any other unknown initiating events like any problems with immunity or any problems in thymus gland or any abnormality in genes, in that cases there is a production of the antibodies. That antibodies will inhibit the binding of acetylcholine with acetylcholine receptor. That is the one thing, and increase in the degradation of acetylcholine receptors, and decrease in the number of acetylcholine receptors due to destroy of the postsynaptic surface. Okay, or it promote the endocytosis of acetylcholine. So there is a resulting in degradation of acetylcholine receptor. So as a result of this three mechanism, there is a blockade of neuromuscular transmission. So there is a muscle weakness is occurs. These are the symptoms of what MG, myasthenia gravis. Okay. Uh, so why thymus abnormalities is causes the MG? Okay, so what is the thymus? Thymus is a gland. Okay, so this gland, it is a one, it is a part of our immune system. Okay, and it is located in the upper chest region. It is beneath the what breastbone, and it may trigger the many. It triggers and maintain the production of the what antibodies. Okay, so that antibodies will damage the what, or it is destruct the what, our acetylcholine receptors. So that's why it may cause us the muscle weakness in myasthenia gravis patients. Okay, so the thymus abnormalities, any the person is suffering with any thymus abnormalities, in that cases the thymus glands is more production of the antibodies, and these antibodies will activate against the acetylcholine receptors. That's why the muscle weakness is occurs in MG patients. And what is the diagnosis of this myasthenia gravis? Okay, so there is a two kinds of test is there. First one is amyloid test. So in this test, first we have to give the endorphonium. Okay, so what is endorphonium? It is a reversible anticholinesterase inhibitor. Reversible anticholinesterase inhibitor. So here the route of administration of endorphonium is IV, intravenous route. So here first we have to give the 2 mg. Okay, the 2 mg of this endorphonium, it is injected to the particular myasthenia patient. Then after 30 to 60 seconds of this administration, again we have to give the 8 mg of the endorphonium. Okay, again we have to inject the endorphonium, that is dose of that endorphonium is 8 mg. Then here what is the effect of endorphonium on myasthenia patient is what, that is increases the muscle strength. Okay, so the muscle strength is increases in myasthenia patient. Only the muscle strength is increased in myasthenia patient, but not other muscular dystrophies. Okay, it is only increases the muscle strength in myasthenia patient, but not other muscle dystrophies. Okay, and it is a one kind of amyloid test. Endorphonium, it is a reversible anticholinesterase inhibitor. Okay, first we have to give the 2 mg after 30 to 60 seconds. Then not minutes, only seconds. After 30 to 60 seconds, again we have to inject the 8 mg. Okay, the route of administration is IV route. Okay, then what is the effect in myasthenia patient is what, the muscle strength is increases in myasthenia patient. Again, and that effect it will be compared with control. Okay, that effect is compared with untreated patient. Okay, it is one kind of test, ameliorative test. Next one is provocative test. So here, myasthenia patients are very sensitive to this D-tuberculin. What is D-tuberculin? D-tuberculin is a neuromuscular blocking agent. Okay, so that myasthenia patients are very sensitive to this drug. Okay, so here in this test, we have to give the 0.5 mg of the D-tuberculin. So what is the effect is occurs in myasthenia patient? That is the muscle weakness is increases. Okay, the muscle weakness is increases in myasthenia patient, and the effect of D-tuberculin in non-myasthenia patient is there is no effect on non-myasthenia patient. The D-tuberculin effect in myasthenia patient is the muscle weakness is increases. Okay, but there is no effect on non-myasthenia patients. Okay, so in D-tuberculin, myasthenia patients are very sensitive to this D-tuberculin drug. Okay, so here after giving this drug, the severity of the muscle weakness is increases in myasthenia patient, but there is no effect on non-myasthenia uh, patients. Okay, so these are the two diagnosis tests. In ameliorative test, the myasthenia strength is increases in myasthenia patient. In provocative test, the muscle weakness is increases. Okay, the muscle weakness is increases in myasthenia patient. Okay, and what is the pharmacological treatment of MG? Okay, so here there is a four treatment approaches is there. Four types of treatment approaches is there. First one is immunosuppressive therapy. Okay, so here by using these drugs, we can suppress our immune system. Okay, and acetylcholinesterase inhibitors. Um, by using of these drugs, we can potentiate the actions of acetylcholine, because of acetylcholinesterase inhibitors are inhibit the acetylcholinesterase enzyme. As a result of inhibition of this enzyme, there is no inactivation of acetylcholine, there is no hydrolysis of acetylcholine. So that's why the acetylcholine actions is increases by acetylcholinesterase inhibitors. Okay, and the third one is plasmapheresis. Okay, and immunoglobulin therapy. Okay, we will discuss one by one now. First one is acetylcholinesterase inhibitors. Okay, so acetylcholinesterase inhibitors and butyrylcholinesterase. Okay, acetylcholinesterase inhibitors and butyrylcholinesterase inhibitors are collectively known as what? Anticholinesterase. Okay, and these anticholinesterase drugs are the anticholinesterases are drugs, the drugs which is increases the levels of acetylcholine, which is potentiates the activity of acetylcholine after it is releases from the cholinergic nerve endings. Okay, and these anticholinesterase drugs are inhibit the two enzymes, that is acetylcholinesterase enzyme and butyrylcholinesterase enzyme, and these two enzymes is required for the inactivation or hydrolysis of acetylcholine. Okay, here this acetylcholinesterase enzyme inhibitors are potentiate the activity of acetylcholine, so that's why it is binds with what? Acetylcholine receptors on muscle cells. Then the nerve signal, it will be transmitted from the nerve cells to muscle cells. There is a promote the communication between the neuronal cells to between the neuronal cells and muscle cells. So that's why the contraction effect is increases at the muscle region. Okay. Here, these anticholinesterase drugs are protects the acetylcholine from hydrolysis process, and it is produces the what kind of effect? That is cholinergic effects. Cholinergic effects is increased by anticholinesterase drugs. Okay, so here the acetylcholinesterase inhibitors and the butyrylcholinesterase inhibitors is collectively known as what? Anticholinesterases. Okay, here this MG is treated by what? Acetylcholinesterase inhibitors. So that is examples of acetylcholinesterase inhibitors what? Neostigmine and endorphonium and pyridostigmine. Okay, so what is the effects of this acetylcholinesterase inhibitors? These drugs are restore the muscle strength. Okay, and improves the what? Muscle contraction. Okay, it is improves the muscle contraction by allowing the acetylcholine releases from the nerve terminal. Okay, it is improves the muscle contraction by allowing the release of acetylcholine from nerve terminals. And neostigmine, the dose of this neostigmine is 15 mg orally 6 hourly, depending upon the severity of that disease. Okay, um, and pyridostigmine, this drug is need less frequent dosing, and if it is intolerable muscarinic side effects is occurs means we can add the atropine to block the side effects of to block the muscarinic side effects. Okay, these are the actions of acetylcholinesterase inhibitors. So mainly these acetylcholinesterase inhibitors are increases the muscle strength and it is improves the muscle contraction. Okay, by allowing the release of acetylcholine from the nerve terminals. Okay, mainly here the neostigmine and pyridostigmine drugs are used for the treatment of MG, and the neostigmine dose is 15 mg 6 hourly, depending upon the severity of this case, severity of that particular condition. And pyridostigmine does not require frequent dosing. Okay, if any muscarinic side effects is occurs means we can add the atropine also. Atropine, it is an anticholinergic drug. Okay. Next, immunosuppressive therapy. Okay, so immunosuppressive therapy, by using these drugs we can suppress our immune system, so that's why there is no production of antibodies. So it is an example, that is glucocorticoids. Okay, and glucocorticoids examples is prednisolone. Okay, and it is the most commonly used immunosuppressant drug, and it is when it is used when symptoms of MG is not adequately controlled by cholinesterase inhibitors alone. Okay, so when this glucocorticoids is used, or when in this immunosuppressants is used, means when the person is uh, when the symptoms of MG is not controlled by this cholinesterase inhibitors. Okay, so in that cases we can use the what glucocorticoids. And what is the mechanism of this glucocorticoids? These glucocorticoids are inhibits the what MHC expression, that is major histocompatibility complex expression. So it is one kind of protein, and this protein will recognize the antigen. Okay, it recognize a foreign antigen. Okay, so as a result of inhibition of this MHC, as a result of inhibition of this MHC, then what will happen? There is a inhibit the production of interleukins. Okay, and there is an inhibit the production of interleukin 1 and interleukin 2 and interferon alpha production. So these interleukins and interferons are mediated the inflammatory reactions. So these inflammatory reactions is nothing but it is a one kind of immune mediated reactions. Okay, inflammatory reactions is nothing but these are the immune mediated reactions. So these immune mediated reactions are suppressed by our glucocorticoid drugs. Because of what is the mechanism of action of these glucocorticoids? Glucocorticoids are mainly suppress the MHC, major histocompatibility complex. Okay, it is one kind of protein, and this protein purpose is it is used to recognize the foreign particles. Okay, after recognition of the foreign particles, then it may lead to production of the various inflammatory mediators. That mediators, it may mediate the inflammatory reactions. So it nothing but it is a one kind of immune mediated reactions. So these immune mediated reactions are suppressed by glucocorticoids. Example is prednisolone. It is most commonly used, and this drug is used for the treatment of MG, and the clinical improvement is occurs within 2 to 4 weeks. And this improvement is the market improvement is occurs in 40% of the individuals. And next one is azathioprine. Okay, so this one is the purine analog. Okay, it is reduces the nucleic acid synthesis. Okay, it is reduces the nucleic acid synthesis. So that's why there is a decrease in the production of, or inhibit the production of, or thereby interfering with the production of T cell and P cell. Okay, so as a result of reducing the synthesis of nucleic acid, there is a proliferation of T cells and B cells is decreases. So there is a T cells and B cells is decreases means that actually the B cells is mediated the antibody production. Okay, so that antibody production is inhibited because of this azathioprine is inhibit the nucleic acid synthesis. So there is no nucleic acid in the cell means there is no survival of B cells and T cells. There is no survival of B cells and T cells means there is no production of antibodies. Okay, and it is very effective in 70 to 90% of the patients with MG. Okay, and when it is used in combination with the prednisolone, it is more effective. So when azathioprine, when it is used along with prednisolone means it's more effective, and it is better tolerated than prednisolone alone. Okay, and beneficial effects takes at least 3 to 6 months to begin. Okay, it takes more time to show the effect, beneficial effect. Next one is calcineurin inhibitor. It is also comes under the immunosuppressive therapy. Okay, and enzyme drug name is cyclosporin. Okay, so cyclosporin drug, it is mainly inhibit the calcineurin enzyme. Okay, as a result of inhibition of this calcineurin enzyme, there is a decrease in the production of the interleukins and T cell proliferation, and there is a block the synthesis of various inflammatory mediators. Okay, and the T cells suppression is occurs, and inflammatory mediators production is also suppressed by cyclosporin. Okay, because of the cyclosporin drug, it is inhibit the calcineurin. So this calcineurin is required for the production of the T cells and B cells, and required for the production of the various inflammatory mediators. Okay, and and it is used mainly in the patient who do not tolerate or who do not respond to azathioprine drug. Okay, so the first preferred drug is what? Prednisolone. Okay, and the combination of azathioprine and prednisolone, it shows a better, it is more effective. The combination of prednisolone and azathioprine is more effective compared to prednisolone alone. Okay, and when cyclosporin is used, when the person is do not tolerated to or do not respond to azathioprine. Okay, next, it is inhibit the synthesis of inflammatory mediators, and the dose of this drug is 4 to 5 mg per kg per day. Okay, but the cyclosporin drug having serious adverse effects is there, that is nephrotoxicity, neurotoxicity, and hepatotoxicity, and hyperlipidemia, and hyperuricemia, and hyperglycemia. Hyperglycemia means the blood glucose levels is increases, the uric acid levels is increases. Hyperlipidemia means the lipid levels is increases in blood. Hepatotoxicity, neuronal toxicity, and many hyperplasia and hirsutism is also occurs. Okay, here the first line therapy of this MG is what? Acetylcholinesterase inhibitors, and the second one is immunosuppressive therapy. In immunosuppressive therapy, two categories is there. So that is three categories is there. So that is prednisolone, that is comes under the glucocorticoids, and azathioprine. Azathioprine is inhibit the nucleic acid synthesis inhibitors, and calcineurin inhibitors example is cyclosporin. So these three category of these drugs are comes under the immunosuppressants. Okay, and um, next one is surgery. Okay, so surgery example is thymectomy. Thymectomy means what? The surgical removal of thymus gland. So as a result of removal of thymus gland, there is no production of antibodies. Actually, the thymus gland is triggers the, and it triggers and it maintains the antibodies. It triggers the production of antibodies, and it is used to maintain the antibodies. But here, after removal of this thymus gland, there is no production of the antibodies. That's why this surgery, it may relieve the signs and symptoms of MG, myasthenia gravis. And plasmapheresis therapy. Okay, and so this therapy, this procedure is uses a what it is it is a procedure. By using this procedure, there is a filtering the process. Okay, it is uses the filtering the process. It is similar to dialysis. Okay, plasmapheresis is nothing but it is a procedure. This procedure is uses the filtering process similar to dialysis. Okay, and the blood is routed through the machine. The blood is routed through a machine, and what this procedure, it is used to remove the antibodies from the uh, blood circulation. Okay, by using this method, we can remove the antibodies from the blood circulation. Especially what kind of antibodies? Those antibodies is block the transmission of the signals from the nerve cell to muscle receptor sites. Okay, so that kind of antibodies are we can remove from the blood circulation. Okay, so this process is totally similar to dialysis. Okay, it is a filtering process. It is a same as a filtering process similar to dialysis, and the beneficial effects of this procedure is usually last for only few weeks. Okay, the duration of beneficial effects is only few weeks. Okay, next last therapy is intravenous immunoglobulin therapy. Okay, so this therapy is provide the body with the normal antibodies. Okay, here we can give the normal antibodies. This normal antibodies which alter the immune system response, and it has the lower risk of side effects. Okay, so here we are injecting the normal antibodies. Okay, and this procedure is having lower risk of side effects than the plasmapheresis and immunosuppressive therapy. Okay, lower side effects than immunosuppressive therapy and lower side effects than plasmapheresis, because of the cyclosporin drug having we the side effects of cyclosporin is very more, that is hepatotoxicity, hyperglycemia, hyperuricemia. Okay, neurotoxicity and nephrotoxicity is there. Okay, so compared to immunosuppressive therapy, this intravenous immunoglobulin therapy having the less side effects, and it can take week or two, it can be week or 2 weeks to start working. Okay, but benefits usually last and less than a month or 2 months. Okay, the duration of benefits effects is 1 month to 2 months. Okay, so by using this plasmapheresis, here we can remove the antibodies from the blood circulation. Okay, those antibodies which cause the which block the neurotransmission from the block the transmission of the signals from the nerve cells to muscle cells. So that kind of antibodies we can remove by using this plasmapheresis process. By intravenous immunoglobulin therapy, by using this therapy we can inject the normal antibodies, not abnormal. Okay, and these normal antibodies which produces the normal immune responses. Okay, so this kind of therapy having the lower risk of side effects than other methods like plasmapheresis and immunotherapy. Okay, and benefits, the duration of beneficial effects is 1 month to 2 months. Okay, but it takes more time to showing this effect. Okay, that is 1 week or 2 weeks. Okay, so this one is what myasthenia gravis. So myasthenia gravis consists of total four treatment approaches is there. So the first line approach is what, acetylcholinesterase inhibitors, and the second line is immunosuppressant, and third thing is plasmapheresis and immunoglobulin therapy, and lastly what, thymectomy surgical procedure is also there. Okay, fifth one is thymectomy, that is a surgical procedure. Okay, this one is information about the what myasthenia gravis, what is myasthenia gravis, and what, how this antibodies is act, and what is the diagnosis of this myasthenia, and what is the pharmacological treatment of this myasthenia gravis. Okay, so in next class we will discuss about the another chapter, that is maybe CNS. Okay, thank you.